Okay, thank you. I'm from China. My topic is analysis of decision-making factor for preventive ileostomy after rectal cancer surgery and their impact on perioperative recovery. So we know that there are advantages of preventive ileostomy in rectal cancer surgery, the PI. However, there's also many disadvantages of PI in rectal cancer surgery, such as cannot reduce overall leakage, can have common complication, affect the post-operative quality of life. So there's a controversy that when should we perform PI procedure after the rectal cancer surgery? So the objective is to explore the decision-making factor for PI after rectal cancer surgery and analyze the impact of the PI on perioperative outcome. This the material inclusion criteria is as follows. So in the last from January 2013 to December 2023, 1,365 patients met the inclusion criteria. This inclusion criteria, such as APR procedure, Bacon procedure, and Hartmann procedure, and so on. The data collection can include preoperative data, operative factor, the tumor factor, and the perioperative outcome. And the symptomatic leakage is classified as B and C grade leakage. So the result, the general data about is 1,082 cases was enrolled, containing 381 patients with PI procedure and others did not undergo PI procedure. For the perioperative factor that affect PI decision making is the sex, female sex, and the intestinal obstruction and operative chemoradiotherapy. The proportion is higher in the PI group. For the operative and tumor factor, there is the number nail used for the distal intestinal closure and distance from the anatomotic side to the anal verge, and surgical time is higher in the PI group. And also for the tumor location, that for multiple longevity regression analysis, the independent risk factor affecting PI is male sex, preoperative intestinal obstruction, preoperative chemoradiotherapy, distance from the anatomotic side to the anal verge less than 5 centimeters, and use of more than one nail for distal intestinal closure, middle to ultra low tumor location, and surgery time more than 3 hours. The impact of the PI on post-operative outcome, it can decrease the post-hospital stay, the placement of the tuber, and previous drainage tuber removal time. However, it can increase the hospital cost. So in our sentence, PI failed to reduce the incidence of anatomotic leakage while increase the hospital cost and shorten post-operative hospitalization, pelvic drainage tube, and removal time. Okay, the relationship between the number independent risk factor in table 3 for PI and anatomotic leakage is with the increase of number of risk factor for PI, anatomotic leakage group have a higher proportion than the non-anatomotic leakage group. Certainly, there are also some limitations in our study, such as a single sentence retrospective study, and fail to explore the impact of the chief surgeon on PI decision making, and so on. Thank you for your attention. Thank you.